Did you know that not all heart attacks come with the typical warning signs we see in the movies? Unlike what we see in movies, where heart attacks are depicted with dramatic scenes of people clutching their chests and gasping for air, the reality is that not all heart attacks are so obvious. Every day we go about our daily activities without thinking about the hidden risks to our health. But did you know that you could be having a heart attack without even knowing it? Many heart attacks go unnoticed due to the absence of classic symptoms, such as severe chest pain. These are called silent heart attacks, and they can happen to anyone. But first, let's talk about what a heart attack is and what causes it. A heart attack, also known as a myocardial infarction, is a serious medical condition that occurs when blood flow to the heart is blocked or drastically reduced. This disruption prevents the heart muscle from receiving the oxygen it needs to function properly, which can lead to the death of heart cells. The main cause of a heart attack is atherosclerosis, a disease in which plaques of fat, cholesterol, and other materials build up in the coronary arteries. These plaques can break off, forming a clot that blocks blood flow. What about silent heart attacks? A silent heart attack has the same characteristics and causes as a conventional heart attack. But what makes it a very serious medical condition is that it can occur without the common warning signs. Silent heart attacks are dangerous because they are often not diagnosed in time. Damage to the heart can accumulate without a person noticing, increasing the risk of serious complications such as heart failure or a major heart attack, and even a fatal outcome. Silent heart attacks can be deceptive, but by knowing the symptoms and taking steps to care for your heart, you can protect your health and the health of your loved ones. These symptoms can be easy to ignore or attribute to other, less serious causes. However, they are warning signs that should not be overlooked. It is very important to know the subtle signs that may indicate a heart problem. And that's what our video is about today, learning to recognize the signs that you or someone you know may be going through this delicate situation without knowing it. The symptoms of a silent heart attack can be subtle and easy to confuse with other conditions. Fatigue. The fatigue associated with a silent heart attack is due to the heart not receiving enough oxygen to function properly. This affects the entire body, causing a general feeling of tiredness and weakness. Remember, fatigue is not always a sign of a heart attack, but it is better to be safe than sorry. If you experience unusual fatigue for no apparent reason, it is important to consult a doctor. Early diagnosis can prevent serious complications. Difficulty breathing. Shortness of breath is a warning sign that often goes unnoticed, especially when it comes to a heart attack. When the heart does not pump blood efficiently due to a blockage in the coronary arteries, the lungs are affected. This happens because fluid builds up. When the heart cannot pump all the blood it receives, it causes the lungs to fill with fluid, making it difficult to breathe and causing a feeling of suffocation. Additionally, by not receiving enough oxygenated blood, the body's tissues, including the lungs, do not get the oxygen they need to function properly. Excessive sweating, especially when not accompanied by physical activity or high temperatures, can be a warning sign of a silent heart attack. Why excessive sweating may indicate a heart attack? Lack of oxygen to the heart can trigger a number of physiological responses, including sweating. When the heart does not receive enough blood, the body reacts by releasing adrenaline, which can cause profuse sweating. Sweating is a great way to get rid of toxins from your body. It is your body's natural response to physical exertion or overly hot and humid climates. But if you're sweating rivers, even as the thermostat is turning down, you need to act quickly. Nausea or vomiting. Especially in women, a silent heart attack can manifest itself in deceptive ways, with nausea and vomiting as the only symptoms. This atypical presentation is often confused with common stomach problems such as indigestion or gastroenteritis, which unfortunately delays necessary medical attention. Dizziness. Dizziness may seem like a non-specific symptom, more related to vertigo or fatigue. However, when it occurs suddenly or persistently, especially in combination with other symptoms, it could be a warning sign of a silent heart attack. When the heart does not pump blood efficiently, the entire body is affected. This can cause a drop in blood pressure, which in turn can lead to dizziness or fainting. Likewise, when the brain does not receive enough oxygen, it causes dizziness and lightheadedness. General feeling of restlessness or discomfort. The feeling of restlessness or discomfort during a silent heart attack may seem disconcerting, but there is a physiological explanation. Here's how to explain it. When the heart does not receive enough oxygen due to a blockage in the arteries, the body experiences a state of stress. This stress can manifest itself as a general feeling of malaise, restlessness, or even anxiety. Lack of oxygen to the heart can upset the chemical balance in the body. This can lead to the release of certain substances that cause feelings of discomfort and uneasiness. The heart and nervous system are closely connected. When the heart is under stress, it can send signals to the nervous system, which generates feelings of anxiety. It is important to note that not all silent heart attacks cause concern, which is why they can be confused with other conditions. Mild pain in the throat or chest. Unlike a conventional heart attack that causes extremely intense pain, the reason silent heart attacks can cause mild pain in the throat or chest, despite their name, is due to the location and nature of the damage to the heart. Pain that is felt in one part of the body but actually originates in another is known as referred pain. In a silent heart attack, the heart and the nerves that supply it share the same nerve pathways with other areas of the body, such as the neck, shoulders, arms, back, and sometimes the jaw and throat. During a heart attack, a blockage in the coronary arteries deprives the heart muscle of oxygen, causing a condition called ischemia. This ischemia can cause pain, but the intensity and location of this pain can vary significantly from one person to another. Why is it sometimes mild or felt in the throat? Pain perception is highly individual and can be influenced by factors such as pain tolerance, age, sex, and other health factors. If the damage to the heart is small, the pain may be less intense and masked by mild throat or chest pain. It is important to note that mild pain in the throat or chest does not always indicate a heart attack. However, if you experience chest or throat pain for no apparent reason, without being infected with a virus, and especially if it is accompanied by other symptoms, it is essential to seek medical attention immediately. Other conditions, such as heartburn, acid reflux, or muscle problems, can also cause these symptoms: pain in the back, arms, neck, or jaw. You may have heard that pain during a heart attack radiates only to the left arm, but that's not always the case. Sometimes, the pain can occur in the center of the chest, right hand, jaw, teeth, abdomen, and also the back. Back pain is different from the pain you feel after sitting at your desk for too long. This is called angina. The pain you feel during a heart attack, whether typical or silent, is due to the way your nerves transmit pain signals. The nerves that innervate the heart share pathways with nerves that innervate other areas of the body, such as the arms, back, and neck. When the heart is damaged by lack of oxygen, nerves send pain signals to the brain, but the brain may interpret these signals as coming from the areas where the nerves share pathways. Why don't all silent heart attacks cause pain? Because the intensity and location of pain can vary widely from person to person. This depends on factors such as the exact location of the blockage in the coronary artery. Other medical conditions can mask heart attack symptoms. You might think your pain is due to bursitis, a muscle strain or tear, or a minor injury. Recognizing that back or arm pain may be a sign of a heart attack is crucial, as it allows you to seek medical attention in a timely manner. It is worth noting that advanced stages of diabetes are often accompanied by neuropathy. This means that the nerves are no longer receptive to stimuli. You may not feel anything after touching something boiling hot or after being pricked by a needle. The same applies to a heart attack as well. A diabetic may not feel a crushing heart attack as strongly. Nerve damage will successfully mute it. According to a 10-year study, 8% of diabetic participants had suffered a silent heart attack and were unaware of it. Indigestion and heartburn. The main reason why a heart attack can be mistaken for a simple stomach ache is that both can manifest as chest discomfort, leading many to underestimate the severity of what they are experiencing. What are the reasons for this confusion? Anatomical location. The heart and esophagus are located very close to each other, sharing the same region of the body. Therefore, pain or discomfort originating in either of these organs can feel very similar. Both a heart attack and indigestion can cause pain that is described as pressure, squeezing, burning, or even a dull ache. This similarity in sensation makes it difficult to distinguish one condition from the other without the help of a health professional. Swelling is not a direct symptom commonly associated with silent heart attacks. However, it is important to understand why this confusion might arise. A silent heart attack, by damaging the heart muscle, can lead to long-term congestive heart failure. One of the manifestations of this condition is fluid retention, which can cause swelling in the legs, ankles, and abdomen. Silent heart attacks can lead to other serious complications. For example, if the left ventricle of the heart is damaged, it can affect its ability to pump blood effectively, which can lead to fluid buildup in the lungs, further causing respiratory failure. So if you've been feeling bloated and uncomfortable lately, it might not be a bad idea to visit your doctor. Flu, cough, congestion. Do you have a persistent flu? Nothing relieves you, not even hot tea, steam inhalations, or anti-flu medicines. We all feel unwell from time to time. It may be due to excessive exposure to the cold or catching an illness from someone who is sick. The influenza virus is responsible for making you cough. You may experience a persistent sore throat and feel nauseous. These symptoms usually take 1 to 2 weeks to completely disappear. But if they do not subside and you feel short of breath, even after a long time, it is best to consult your doctor. These are the signs you should look out for, because silent heart attacks can be deceptive. They can be confusing, and no one knows your body better than you, what you feel when you are feeling unwell, or if any of the symptoms you are experiencing are out of the ordinary. How is a silent heart attack diagnosed? A silent heart attack can be difficult to detect due to the lack of obvious symptoms. However, there are several medical tests that can help health professionals diagnose it. These tests are crucial to identify heart damage that has occurred and take steps to prevent future complications. If you have experienced any of the signs described, your doctor will order an electrocardiogram. This test records the electrical activity of the heart and can show changes characteristic of a heart attack, even if there were no symptoms. You will also be given a blood test that will measure certain markers, such as troponin, that increase in the blood when there is damage to the heart muscle. Another diagnostic test is an echocardiogram, which uses sound waves to create images of the heart in motion and can show damaged areas of the heart and assess its function. A stress test is used to assess how your heart responds to exercise. If there is a blockage in your coronary arteries, your heart may not receive enough oxygen during exercise. Catheterization involves inserting a catheter into an artery of the heart to view the coronary arteries and assess blood flow. Why are these tests important? They can identify silent heart attacks early, even if there are no symptoms, and help determine the extent of damage to the heart. They can also reveal other cardiovascular risk factors, such as the presence of plaque in the arteries. The results of these tests help doctors determine the best treatment for each patient. When are these tests performed? If a heart attack is suspected, if a person has risk factors for heart disease, or if a heart attack is suspected based on silent symptoms, these tests may be ordered. In some cases, these tests may be performed as part of a routine medical checkup, especially in people with risk factors. It is important to remember that only a doctor can interpret the results of these tests and provide an accurate diagnosis. How is a heart attack treated? Treatment for a heart attack aims to restore blood flow to the heart, limit damage to the heart muscle, and prevent future complications. Specific treatment will depend on the severity of the heart attack, the location of the blockage, and the individual conditions of each patient. Doctors may use medications to dissolve the clot, perform a procedure called angioplasty to open the blocked artery, or perform coronary bypass surgery if the blood vessels have narrowed too much. Medications that may be prescribed include aspirin, nitroglycerin, beta blockers, and thrombolytics. The cardiologist will determine the dosage of each of these based on the needs of each patient. Risk groups. Certain people are more likely to suffer a silent heart attack. Risk factors include patients with hypertension, diabetes, high cholesterol, obesity, and smoking. People with a family history of heart disease, preeclampsia during pregnancy, and COVID-19 are also considered. Can we prevent a heart attack? Prevention will not always prevent a silent heart attack. There are conditions that are sometimes beyond your control. But while you can't always completely prevent a heart attack, there are many things you can do to reduce your risk, such as maintain a healthy diet, focus on eating nutrient-dense, fiber-rich foods, increase your intake of fruits, vegetables, and whole grains. The fiber in raw vegetables can keep your heart in tip-top shape. Remember to regularly eat foods rich in omega-3s, like salmon, avocado, and nuts. Reduce your intake of saturated fats and cholesterol. Say no to unnecessary snacks and sweets. Have a piece of fruit when you have a sweet craving. It will help you better control your blood glucose level. Get regular physical activity. Make healthy changes. Start exercising. Start by walking around the block. Start walking slowly and at a brisk pace. In a few days, you will feel motivated to go jogging. Practice meditation or yoga. They will have a positive effect on your heart health. Combine it with aerobics, dancing, or Zumba. Finally, don't forget to add some resistance training. Control blood pressure and cholesterol. All of this under the supervision and recommendations of your doctor. Quit smoking. Smoking is a major risk factor for heart disease. Scientific studies have shown that smoking tobacco causes the arteries to narrow and supplies less oxygenated blood to vital organs. Maintain a healthy weight. Obesity increases the risk of heart disease. By controlling your weight, blood glucose levels, cholesterol, and blood pressure, you can prevent atherosclerotic plaque from becoming a blockage. Manage stress. Chronic stress can contribute to heart disease. Visit the doctor regularly. Regular medical checkups can detect heart problems at an early stage. You don't have to wait for a heart attack to begin medical treatment. Preventive cardiac care can prevent you from having one. Long-term effects. If you've survived a heart attack, you may think you've conquered the #1 killer, but be aware that it has dangerous side effects. In some people, it can cause the heart to lose its normal rhythm and develop a condition called cardiac arrhythmia. Other long-term effects also increase the risk of having a stroke in the future. It's pretty hard to believe that something as big as a heart attack can happen without you knowing about it, right? But research says that 45% of heart attacks are silent. And not only that, did you know that a silent heart attack increases the chances of having another one by 35%? It's no joke. It is also important to note that postmenopausal women over 55 and men over 45 have an increased risk of heart attack. The duration of a heart attack is different for each person. Most commonly, it lasts between 15 and 30 minutes. Anything beyond that causes irreversible changes. The symptoms of a silent heart attack are so subtle and misleading that they are often misinterpreted as signs of less serious conditions, delaying timely diagnosis and treatment. I know these signs seem really hard to spot, but trust me, your body will know when you feel different. During a silent heart attack, the patient may not even go to the hospital and may still be alive. This doesn't mean you can simply dismiss silent heart attacks as trivial. A silent heart attack can cause permanent damage to the heart if not treated in time. By recognizing the symptoms and seeking medical attention immediately, steps can be taken to limit the damage and improve the prognosis. If you experience any of these symptoms, especially if you have risk factors, it's important to see your doctor. An early diagnosis can make all the difference. We have reached the end of our analysis of silent heart attacks, a topic that should keep us vigilant about our health and lifestyle habits. Tell us in the comments, did you know about this type of condition? Do you know anyone who has suffered from it? How did they realize what was happening? Thank you for joining me. If you found this topic interesting, please give us a like, and I invite you to a future health and wellness meeting on this channel. See you soon.